how lucky we are to be here in such a good weather, looking at all the beautiful women and gentlemen supporting women's cause. Thank you so much. And a big round of applause to all the women, beautiful women out there, who have a right to be creative, right to be active, right to work, right to be whoever they want to be. As I talk about women's rights, I always think about one quotation that Roosevelt said, no one can make you inferior without your consent. साँच्चीकै भन्ने हो भने पनि कसैले पनि तपाईलाई सानो मान्छे भन्नै सक्दैन, तपाई आफैले कन्सेन्ट दिनुपर्छ, नभए कसैले तपाईलाई हेर्न सक्दैन। महिला अधिकारका कुराहरू विश्वव्यापी रूपमा भइरहेछ। अहिले there are thousands of countries celebrating women's rights, achieve गर्ने कुराहरू पनि छ। आमा, दिदी, बहिनी, there are thousands of things हाम्रो महिलाहरूले गर्व हुने कुरा र म महिला भएर गर्व गर्छु आफूलाई। मलाई राम्री हुन मन लाग्छ, मलाई एक्टिभ हुन मन लाग्छ, म घरमा के काम गर्छु, म रेस्पेक्ट गर्छु, म दिदी हुँ, म बहिनी हुँ, म बुहारी हुँ, म आमा हुँ, सबै रोल गर्न सक्ने भनेपछि कति स्ट्रेन्थ छ ममाथि। कति हामीले महिला दिवसको दिनमा यो एउटा महिला शक्तिलाई चाहिँ हामीले बुझ्नै पर्ने हुन्छ। महिला शक्ति भनेको ठुलो शक्ति हो, एउटा पुरुषलाई जन्म दिन सक्ने शक्ति, यो संसार चलाउन सक्ने। आज संसारलाई हेरौँ, हामीले हेर्दाखेरि त नेपाल आमा भन्छौँ हामी, होइन? अब अमेरिकालाई पनि हर भन्छौँ, सबै हर भनेर जान्छौँ, त्यो सबै महिला नै सृष्टिकर्ता। त्यसकारण अब हामी चाहिँ America-Nepal Women Association of Greater Washington DC is a 501c approved non-profit organization. We have two speakers today. Lisha Holmes, she is here. She has been very, very active. She has been working with this industry for many years. And we have the honor to have our own Kiran Sitala here, who has been always helpful to America-Nepal Women Association without any condition, reservation. He's always there on this. He's kind of our team, our part of team. We never had to invite him. He was just like, hey, do you need help? I also want to thank all the team of ANWA for so many years. We are together. We're working on it. Even in a small scale, we're doing something. I'm so proud of all of you that we're still together. Whenever there is a work, we jump in and do together. That has been our strength. धेरै गर्न सकेका छैन, अलिअलि गरिरहेछौँ, तर जहिले पर्यो भने पनि हामी बेलामा आएर जहिले जे गर्न पनि गरि नै हाल्छौँ। America-Nepal Women Association को अब म चाहिँ प्रेसिडेन्ट विष्णु थापालाई वेलकम नोटको लागि बोलाउन चाहन्छु। त्यो भन्नुभन्दा अगाडि मैले अर्को कुरा बिर्सिछु, मेरो नाम चाहिँ माधवी बस्नेत कार्की हो। विष्णुजी तपाईँ आएर चाहिँ गेस्टहरूलाई वेलकम गरिदिनुहोस्।
First of all, happy Women's Day to all of you. America-Nepal Women Association of Greater Washington DC का तर्फबाट speakers Ron Sitolaji, Lisa Humes, अनि यो आजको कार्यक्रम अर्गनाइज गर्नलाई कोअर्डिनेट गर्ने माधवीजी, लगायत संघ संस्थाका रिप्रेजेन्टेटिभ्स, मेरा एनवाका साथीहरू सबैलाई र हाम्रो पत्रकार मिडियाका हाम्रा inapliz.com बाट विश्वराज थापाजी अन्त कार्यक्रम छोडी आउनु भएको छ। उहाँहरू सबैलाई हार्टफेल्ट हृदयदेखि नै म स्वागत गर्न चाहन्छु आजको कार्यक्रममा। र अनुभवको बारेमा माधवीजीले अलिकति हाइलाइट गरिहाल्नुभयो र आजको कार्यक्रमको बारेमा फर्दर स्पिकर्सहरूले अगाडि कुरा बढाउनुहुन्छ। तर आज अन्तर्राष्ट्रिय महिला दिवस भएको हुनाले म अलिकति अन्तर्राष्ट्रिय महिला दिवसको बारेमा यो आज जुन मैले एप्रोप्रिएट ठाने त्यस्तै हिसाबले अङ्ग्रेजीमा मैले अलिकति तयार गरेर लिएर आएको छु, त्यो छिटो सिद्धाउनको लागि त्यो गर्छु। So welcome. It would be appropriate to quote the statement made by Michelle Bachelet, Executive Director of United Nations, for gender equality, and she is the entity for the gender equality and empowerment of women. So what she did today, that was her statement this morning. I'm not going to do the entire thing, but I have a few paragraphs from her statement. Then I would like to quote that will highlight on the situation of women's rights around the world. From women, we have UN women in the United Nations. Okay, the code goes this way. This International Women's Day, I join women around the globe in solidarity for human rights, dignity, and equality. This sense of mission drives me and millions of people around the world to pursue justice and inclusion. Looking back at the first year of UN Women, I applaud every individual, government, and organization working for women's empowerment and equality. I promise the highest commitment moving forward. The creation of UN Women has coincided with deep changes in our world, from rising protests against inequality to uprising for freedom and democracy in the Arab world. These events have strengthened my conviction that a sustainable future can be reached by women, men, and young people enjoying equality together. From the government that changes its laws to the enterprise that provides decent work and equal pay, the parents that teach their daughter and son that all human beings should be treated the same, equality depends on each of us. During the past century, since the observance of First International Women's Day, we have witnessed a transformation in women's rights, educational achievements, and participation in public life. In all regions, countries have expanded women's legal entitlements. Women have taken many steps forward. More women are exercising leadership in politics, business. More girls are more girls going to school, and more women survive childbirth and can plan their families. Yet, while tremendous progress has been made, no country can claim to be extremely entirely free from gender-based discrimination. This inequality can be seen in persistent gender-based gaps and unequal opportunities in low representation of women in leadership, in public office and private sector, in child marriage and missing girls due to son preference, and in continuing violence against women in all its forms. Nowhere are disparities and barriers greater than rural areas for women and girls. Rural women and girls, they work long hours with little or no pay and produce large proportions of food grown especially in subsistence agriculture. They are farmers, entrepreneurs, and leaders, and their contributions sustain their families, communities, nations, and all of us. Yet they face some of the worst inequalities in access to social services and other productive assets. So, unquote, and then she mentions a lot of things that we need to do, like climate change, politics, political instability, economic. Nothing is possible without full empowerment of women. And then there is so much to do, something for everyone to do. Safeguard the achievement that we have made this far, the progress that we have made, and all the work that is ahead of us, that all of us are equally responsible. So, यो महिला सम्बन्धी के भइरहेछ त संसारमा र वुमेन जुन युएन वुमेन छ त्यसले केसम्म अचिभ गर्न सकेछ र कहाँ पुग्दैछ भन्ने कुराको एउटा सर्टकटमा दिँदाखेरि जति जे भए तापनि वुमेन डिस्क्रिमिनेसन जुन छ संसारभरि कुनै पनि कोही पनि मान्छे अहिले पनि फ्री भएको छैन। हामीले त्यो गोल चाहिँ पुरा गर्न सकेका छैनौँ र हामीले गर्नुपर्छ भन्ने यही कोटका साथ म यहाँहरू सबैलाई फेरि एकचोटि यहाँ स्वागत गर्दै हाम्रो स्पिकर्सहरूबाट कुराहरू सुन्नुहोस् र आन्वा महिला अर्गनाइजेसन भए तापनि सुरुदेखि देख्दै आउनुभयो होला र यो कुराहरूले पनि बुझ्यो होला कि वुमेनको अर्गनाइजेसनले गर्ने काम खालि महिलाको अधिकार मात्र होइन, महिला अधिकार प्राप्तिको लागि, कम्युनिटीलाई सस्टेनेबल बनाउनको लागि, कम्युनिटीलाई स्ट्रङ बनाउनको लागि इन्फर्मेटिभ प्रोग्राम गरेर कम्युनिटीलाई सपोर्ट गरेर स्ट्रङ बनाएर मात्रै एकता हुन्छ अथवा डिस्क्रिमिनेसनहरू कम हुन्छ भन्ने हाम्रो विश्वास हो र सुरुदेखि हामीले त्यही गर्दै आएका छौँ र आज यो उपलक्ष्यमा पनि हामीले अहिलेको नयाँ जल्दो बल्दो इस्यु जुन हाम्रो कम्युनिटीलाई अति नै आवश्यक हुन्छ, जुन ओबामा केयर भनेर कम्पलसरी हेल्थ इन्सुरेन्सको कुराहरू आएको छन्, त्यसका स्पेसलिस्टहरूले त्यो कुरामा हाइलाइट गर्दैछन् र हामीले अवश्य पनि हाम्रो कम्युनिटीलाई पनि सेयर गर्नको लागि र हाम्रो लागि पनि केही फाइदा हुनेछ भन्ने आशा राख्दै यहाँ सबैलाई यहाँ आइदिनु भएकोमा धन्यवाद दिँदै म यही रुचाउँछु।
Thank you, Mr. J. What a beautiful way of citing the United Nations Women Michelle's statement towards International Women's Day. Actually, what we thought in ANWA is every year we have been doing program International Women's Day with different theme, and we thought this time is, when you look at around the world, illiteracy rate among women, lack of information among women is the most thing that we feel that we are behind. So we thought about, let's talk about the Affordable Care Act this year because it's going to affect us. And our title is, we have to know how it is going to affect us. In doing so, Lisha, I wanted to tell you that we as an ANWA has been doing America-Nepal Women Association is running free monthly clinic for insecure people in Maryland. The initiator of ANWA, the lady like Rita Tiwari, she is here. It is her concept to start America-Nepal Women Association free medical clinic with the support of Dr. Mr. Vaidya. Mr. Vaidya has been continuously providing, and our team here, especially 4 or 5 volunteers from America-Nepal Women Association, every month they are driving to Maryland. We have a place in church. We are giving a free medical service. So I wanted to welcome Vice President of America-Nepal Women Association, Ms. Sunita Sivakoti, who has been dedicated from day one until today, to highlight about the objectives of the program. Ms. Sivakoti, please come here.
नमस्कार, मेरो नाम सुनिता शिवकोटी हो। केही कुरा चाहिँ म नेपालीमै अलिक छिटो भन्ने कोसिस गर्छु। भनिहाल्नुभयो कि हामीले चाहिँ यो फ्री हेल्थ क्लिनिक सुरु गरेका छौँ हैन। 7 वर्ष भयो, 2007 देखि सुरु गरेको, जनवरीदेखि 6 इयर्स पुरा भएर 7 इयर्समा रनिङ भइरहेको छ। अहिले चाहिँ आएर हामीलाई कस्तो अनुभव भयो भनेदेखि यो जुन ओबामाले जुन यो हेल्थ केयर सिस्टममा जुन परिवर्तन अमेरिकामा भइरहेको छ, जुन चाहिँ मार्च चाहिँ डेडलाइन हो भनेर हामीले थाहा पाएको छौँ। त्यसले चाहिँ अब हाम्रो संस्थागत रूपमा हामी कसरी यसलाई इन्टरलिभ गर्ने भनेर भन्दाखेरि दुईटा कुरा छ। आज इन्टरनेसनल वुमेन्स डे भएको हुनाले एउटा चाहिँ हेल्थ राइट्स, अल्सो वुमेन्स राइट्स, अनि हेल्थ राइट्समा चाहिँ न्युट्रिसनको कुरा, रिप्रोडक्टिभ राइट्सहरूको कुरा। त्यस हुनाले गर्दाखेरि यो एज अ जेनरल चाहिने राइट्स, हेल्थ राइट्स इज अल्सो पार्ट अफ द ह्युमन राइट्स। त्यस हुनाले एउटा कुरा त्यो भन्न चाहन्छु यो इन्टरनेसनल वुमेन्स डेको परिप्रेक्ष्यमा। अर्को कुरा चाहिँ हामी नेपाली यति धेरै कम्युनिटी अमेरिकामा भइसक्यौँ र यहाँ कुनै पनि लमा चेन्ज भयो भने त्यसले हामीलाई डाइरेक्ट असर पार्छ र यो हेल्थ केयरमा यत्रो उथलपुथल छ। अनि खास गरी यो वुमेन्स अर्गनाइजेसन भएको हुनाले किन यो हामीलाई चाहिँ सान्दर्भिक भयो भन्दाखेरि दुईटा कुरा। एउटा चाहिँ वुमेन्स राइट, हेल्थ राइट्स, वुमेन्स राइट एउटा नम्बर 1 इस्यु। सेकेन्ड इस्यु चाहिँ हामी आफैले 7 वर्षदेखि चाहिँ नि फ्री क्लिनिक चलाएको हुनाले यो चाहिँ हामीले एउटा चाहिँ आजको इन्टरनेसनल वुमेन्स डेमा यो हामीले थिम राखेर यो नेपाली कम्युनिटीलाई जानकारी दिनुपर्ने चाहिँ हाम्रो एउटा मोरल अब्लिगेसन हो जस्तो हाम्रो संस्थाको साथीहरूलाई लागेको हुनाले यो चाहिँ हामीले गरेको हो। र एक्सपर्टहरू दुईजना हुनुहुन्छ, उहाँहरूले यो कुरा भन्नुहुन्छ है। अनि अब अनइन्स्योर्ड नेपालीहरूको लागि हामीले 7 वर्षदेखि त्यो गरिरहेछौँ। अब यो अहिलेको नयाँ एक्टले हाम्रो क्लिनिकलाई के असर पर्छ, यसको फ्युचर कस्तो हुने हो, अब यसमा चाहिँ अब लिगल मान्छेको स्ट्याटसहरुकोमा चाहिँ कति किसिमको सुविधा छ। जो मान्छे हाम्रो क्लिनिकमा आउनुहुन्छ खास गरिकन अहिलेसम्मको 7 वर्षको अनुभवमा कि विद्यार्थीहरू जसको इन्स्योरेन्स छैन, के चाहिने अब किनभने हामीले अनइन्स्योर्ड नै भनेका छौँ। र कस्तो चाहिँ भने भिजिटिङ प्यारेन्ट्सहरू जो चाहिँ माइग्रेन्ट भएर चाहिँ यहाँ आउनु भएको छ, छोरी ज्वाइँ छोरा बुहारीहरू, उहाँहरूको रिलेटिभ्सहरू जो यहाँ आउनुहुन्छ सर्ट टर्मको लागि, उहाँहरूसँग इन्स्योरेन्सको सुविधा छैन। त्यस हुनाले गर्दाखेरि त्यो मान्छेहरू चाहिँ हाम्रो चाहिँ एउटा पेसेन्ट चाहिँ उहाँहरू हो। त्यस हुनाले गर्दाखेरि यसमा चाहिँ यो अहिलेको नयाँ लले चाहिँ केही असर पार्छ कि पार्दैन, त्यस हुनाले त्यो कुरा म आफैलाई पनि जान्न मन छ किनभने हामीले पनि फ्युचर एक्टिभिटिजहरू गर्नुपर्छ त्यस हुनाले गर्दाखेरि आज म बोल्न भन्दाखेरि पनि सिक्न र यो दुईटा परिप्रेक्ष्यमा मेरो आफ्नै पनि केही क्वेसनहरू हुनेछ त्यस हुनाले यसमा म धेरै कुरा भन्दिनँ अब नेपाली कम्युनिटीमा हेर्नुवा के हो हेर्नुवाले के गर्यो विगतमा इन्टरनेसनल वुमेन्स डेमा कस्ता कस्ता टिमहरूमा गर्यो तपाईँहरूले चाहिँ त्यो हेर्नुभयो भने थाहा हुन्छ र धेरै मान्छेलाई थाहा पनि छ त्यस हुनाले गर्दाखेरि यसमा समय नखेर फालेर म आजको चाहिने वक्ताहरूबाटै धेरै कुरा सुन्ने र क्वेसन एन्सरमा मोर इन्भल्भ हुने त्यो गर्दछु थ्याङ्क यू भेरी मच सबैजना आउनुभएकोमा
Thank you, Sunita. Now let's move into a program. Lisa, what we are, this is kind of formal, informal kind of gathering. How we're going to do is like you present what you have to present first, and then Ron will continue follow you to present, and after that we will assign some time for question and answer. And then if needed, then we will work as an interpreter from Nepali to English. Specialized interpretations for questions when you one of the program सीताजीले भन्नुभएको जस्तो मलाई पनि डिफ्रेन्ट थाहा छ मलाई थाहा भएन भने मैले कम्फर्टेबल के भन्नलाई पनि सोच्न पर्यो के किन भन्दाखेरि अब ओबामा के भन्दाखेरि त्यो बायसनेस जस्तो भइरहेछ कि मान्छेको निक्नेम मात्र जानु भएन नि मेन एक्ट जुन हो त्यसमा जानु पर्यो त्यसकारण म आफै पनि विद्यार्थी हो त्यसकारण लेट्स वेलकम लिसा Humes and she has been so kind and generous enough to be we have been communicating since January and she's the one to follow with me. She even came yesterday to check in, and I was like, you know what, hats off to you, and it is our honor to have you as a woman, first woman speaker on International Day, that I have not met with many speakers who came earlier to check in and make sure everything is fine. You're our type, so we're going to keep you for a long time. Welcome, Lisa, this forum is yours.
Thank you very much for having me today. To tell you a little bit more about myself before I get started, and start off with a couple of stories, if I might. I actually have been a healthcare provider for many years, including working in area hospitals, including Virginia Hospital Center, Fairfax Hospital, Fair Oaks Hospital, and Reston Hospital. I worked in the radiology department. I worked my way up the ladder. I became middle management. I was an educator at Northern Virginia Community College, temporarily adjunct faculty at George Washington University as well. And I worked my way up the ladder, got to be middle management, and one day I found myself caught in a restructuring. All the positions at my level were cut, and I was laid off. So I ended up going to health insurance because it seemed like a good fit for me. It was important for me to be able to find some place when I landed to get a company that had same kind of moral, ethical standards that I was used to. So where I am, I feel very comfortable. So now I am a personal benefits advisor, healthcare reform specialist, and a licensed insurance agent. I'm licensed in Virginia and in Maryland. I would like to start off with just a couple of personal stories before I begin with my presentation. And one of the things that I want to relay to all of you is how important it is that you find yourself some sort of coverage and that you have health care in your family and for yourself. I know of a gentleman who thought his health insurance premiums were too much money. He canceled his insurance. He's a truck driver. He was driving one day and collapsed on the job. He ended up being life-flighted to Baltimore. Had open heart surgery because he had had a heart attack. He is now, because he had no insurance, he's still paying off a $450,000 bill. If he had had insurance, the maximum amount that he would have had to pay would have been greatly reduced. In today's world, the most he would have had to pay out of his pocket is $6,350. Now he's trying to pay off this hundreds of thousands worth of medical bills. The second story I want to tell you about is about another client who decided to get their health insurance. They were offered life insurance, but they turned that down because the young child, or younger daughter, was only in her early 30s, and the mother didn't think she was ready for life insurance at that time. But ended up calling back a couple of weeks later and said, you know, I really wish we would have taken the life insurance, and this is the reason why. My daughter was just involved in an auto accident last week and was killed. She was only 32 years old, but she had no health. She had health insurance, but she had no insurance, life insurance. So there was no one to help pay for those final expenses and those last expenses that come through. So her mother was left with that large debt. The third story is a very personal one to me. My daughter was involved in a horrible crash 2 days ago on 495. And one of the reasons why I was late, I was talking to the state trooper this afternoon. She was extremely lucky. She walked away from the accident, but it happened at Tyson's Corner on 495. A dump truck rear-ended her, totaled her car. They couldn't get her out because most of the doors would not open. But she was able to get out of the car. She was able to walk away. Thank goodness she had the foresight of hindsight. She looked in her rearview mirror and saw this truck going way too fast. She tried to swerve and get out of the way. He still ended up running over top of the back quarter panel on her car, broke off the tire, and tore the back axle away from the car. It's totaled. But the point is, you just don't know how soon and how quickly these things can happen. I thank God that she's still here with us, and if I had the choice to make it a car or for her to still be here, I'm very thankful that she is. But I want to make sure that you all know that it can happen to anyone at any time. So please do take those extra steps to get yourself and your family covered. Okay? All right, with that in mind, let me continue on with my information that I'd like to share with you today. The Affordable Care Act. This isn't going to run through the slides, I guess. It's wiped away. Okay. So the slides that I have today, the information that I've received and I'm presenting to you comes both from my company, which is Health Markets, and from the Internal Revenue Service, or the IRS. Okay, thank you. All right. So the idea is, what do I need to do to be able to comply with the Affordable Care Act? All right. So the first things that we want to do is to educate you on where to go and where you can get your information. You can go to the healthcare.gov website. You can make a phone call and talk to one of the navigators. You can purchase health insurance from an agent or from a private agency. There are some options to be able to get some help also with your monthly premiums, depending upon your situation. So some things that are different this year for the Affordable Care Act is that now there is guaranteed issue. No one can be denied coverage during the open enrollment period. It used to be that if you were sick, if you had heart disease, cancer, stroke, you wouldn't be able to get health insurance. But now that's all changed. You can be in a hospital in the middle of a heart attack. You make the application, they have to accept you as a client. The individual mandate is that individuals are required to have health insurance or to pay a penalty next year on your taxes. So getting health insurance this year is a key. There are some rules in how they set the premiums and what they can do to make a difference, what the variations are from person to person. There are subsidies or tax credits that are available to a lot of folks, depending upon your income, how many people in your family, and your situation. The exchanges are marketplaces where you can choose and enroll for plans, and plan structures are defined now by the federal government by the mandate. So beginning this year in January, most individuals are required to have that minimum essential coverage, and the minimum essential coverage is a plan that's offered by an employer, individually purchased plan, either privately or on the exchange, a grandfathered health plan. That means the grandfathered plans were written on or before March 23rd, 2010. And that's the day that the Affordable Care Act was signed into law. So anything that was written before that time, you are able to keep it if you still have one. The federal programs such as Medicare is typically for those that are disabled or over 65, Medicaid for those that are low income, TRICARE, which is for veterans and military folks, and the CHIP program, which is the Child's Insurance Program. So any of those things will qualify as the minimum essential coverage, and you won't be liable for a penalty. So the insurance ratings now are geared, the only thing, since they can't charge you anymore if you're a sick individual, what can they charge you for? They can charge you by your age. So those of us who are older pay more for our health premiums than a young person would. For example, someone who is 21 years of age would pay, say for example, they pay $200. A 64-year-old can't pay more than $600. So it's a 3-to-1 ratio. If I use that 21-year-old again and talk about tobacco use, that 21-year-old who pays $200 that doesn't smoke, the one that does smoke, who's 21, will pay $300 a month. Okay, so they can charge you 50% more. The rates are also based on geographic areas because insurance does cost more depending upon where you live. Here in the metropolitan area, it costs more than it does in Georgia or Atlanta or somewhere else. Also, family rates, it depends how many people you're going to cover on your plan, how much your premiums will cost. So the family premium is the sum of all the individuals for each adult, and then as many as 3 children in the family. So let me give you an example. If you have a family of 10, and you have 2 adults and 8 children, your 2 adults will both pay a premium for their health care. The first 3 children who are under the age of 21 will pay a premium for their health care. The last 5 children are covered for free. Okay. But once they reach the age of 21, every adult has to pay a premium. Okay. So there are tax credits. What is a tax credit? It's paid for by the federal government to help reduce the monthly premiums for those individuals who qualify. The tax credit's determined by your income, family size, and the cost of insurance in your area. It's based on the anticipated income for 2014. So when you apply, you have to give them some sort of an estimate on what it is you're going to make. And the tax credits are only available for qualified health plans on the exchange, on the health exchange. So you have to go on the marketplace to be able to purchase those, to be able to qualify for a tax credit. You cannot buy private insurance and get a tax credit. Okay. As we all know, the open enrollment period started October 1st, 2013, and it provides access to insurance information. It's a place where you can purchase your health insurance. And there are 3 basic models for the marketplace. You can have a state-based plan, which is the Maryland state has their own state-based exchange. Then there's the federal and state partnership, which is DC's model. They have kind of a combination or a hybrid between their state and the federal exchange. And then we have the federally facilitated exchange, which is Virginia's model. So you have to go on healthcare.gov, the federal exchange, if you live in the state of Virginia. Open enrollment, of course, closes on March 31st. So it's coming up very quickly. If you don't have health insurance by March 31st, you cannot apply for it until the open enrollment period starts again in October, unless you have a special event occur in your life. So what do the plans cover? This year, the plans cover what's called the 10 essential benefits. I'm looking for my pointer here. See if I can get that to work. I can. All right, so we have ambulatory patient services, emergency, hospitalization. New this year is maternity and newborn care, mental health and substance abuse, and this one at the bottom, pediatric services, including oral and vision care. Those are all new this year, incorporated in every plan. There has to be some allotment for those things in every plan. So whether you need them or not, there still has to be some allotment in there. So you can see that because they've added additional benefits, they have made it mandatory for everyone. Everyone gets insurance no matter how sick you are. So that's one of the reasons why the rates have gone up, and they've gone up quite a bit, actually. So the fact that some people are able to qualify for those tax credits make a big difference in your ability to be able to pay for those plans every year. One other thing I want to make special note of, and that is this preventive and wellness. That's a big thing for a lot of people this year because we had it in plans last year. It continues on through this year. It's part of the mandate. But what it means is that all your physicals, your preventive care is included at first dollar coverage, no out-of-pocket cost to you. So if you have to go to the doctor on a yearly basis to get your physical, they do blood work as part of that physical, screening, anything that you need as a screening, it's included at 100%. So ladies, if they need to go get a pap smear, mammogram, those kinds of things are included at 100%. You get to be old enough where they recommend a colonoscopy. That also is included at 100%. The children need to go regularly for their physicals and their vaccinations. Those are also included. So those things are really good. And it doesn't matter what kind of plan you have. If it's one that costs a little bit of money with little coverage and maybe a lot of out-of-pocket exposure, you still have that preventive care covered at 100% every plan. Okay. One thing I would like to make mention of, when it doesn't cover at 100%, say for example I go in for my mammogram, they call me back and they say, you know, I think we see something, we want you to come back again. I go back, I have additional views and then a biopsy. Now that whole visit, instead of being a well visit, turns into what they would call a sick visit, and it does apply towards your deductibles. There will probably be some out-of-pocket costs. So it can change, but once the blood work and everything is done, if everything's negative, it's all covered at 100%. Okay. And I'm sure there'll be questions about that later. What the metal plans are, they're all covered now in different metal series. It's called the bronze, silver, gold, and platinum. And of course, the most coverage is at the platinum level because it's the most expensive metal. It's also the most expensive plan per month that you would purchase. Those plans are supposed to cover an actuarial value. They talk about actuarial values 60, 70, 80, and 90. Does that mean it's going to cover 60, 70, or 80, and 90% of your health care? Not necessarily, but it is for the coverage of a large pool of people or group. It's just how they're classifying them. So now you will find multiple plans at the bronze level, multiple at the silver, etc. That one at the bottom for catastrophic, it typically only applies to the young. There are a few exceptions to that, but it's usually for those who are under the age of 30. All plans have now a limit on out-of-pocket expenses. Used to be, last year, we could find on the individual marketplace plans that would be $2,000 to $12,000 in deductibles alone. Out-of-pocket costs could go as high as $25,000. This year, the maximum out-of-pocket for an individual is at $6,350, $1,270 for a family. You have to do it 2 times, and it doesn't matter how many have in your family. If it's 2 or 10, you only have to do it 2 times. Out-of-pocket expense limits are reduced for those below 400% of the federal